Welcome back to this week's OIS podcast. Today, our host, Dr. Paul Karpecki, chats with Neurolens founder and optometrist Jeffrey Krall. Together, they discuss a novel solution for many chronic dry eye symptoms, Jeff's switch from aviation to optometry, and the family business in Mitchell, South Dakota. Over to you, Paul.
Hello, and welcome to the OIS podcast. I'm Dr. Paul Karpecki. I practice in Lexington, Kentucky as Director of Cornea and External Disease at Kentucky Eye Institute, as well as an Associate Professor at the University of Pikeville School of Optometry. I've got a real exciting guest today because it's someone I've known for a long time as a friend who greatly helped me in clinical practice. I think I've had a couple interviews like that, but not many, where it's someone who really made a difference. And when I see those kind of people, I think they're going to make a big difference in many clinicians' practices and many patients ultimately, most importantly, but even from an industry standpoint, just kind of understanding that entrepreneurial spirit and how it became what it is. And so today's guest is a colleague of mine, Dr. Jeff Krall, who practices in Mitchell, South Dakota, but he was the founder of Neurolens. Jeff, welcome to the program.
Paul, thanks for having me on today. I'm excited to chat with you.
I'm honored to have you here too. And I got lucky enough that I met Jeff over a decade ago, and he had reached out to me, and I'm so thankful for that because, I'd really been working in the area of dry eye disease and trying to solve these patients. And you get these buckets of patients that you just couldn't figure out what was going on, why you couldn't make them better. And Jeff called and said, "Hey, do you have some dry eye patients that you just can't seem to resolve their symptoms? And maybe you get rid of some of the signs, but can't resolve their symptoms." And I said, "Yeah, I certainly have those." He said, "I'm going to fly myself there. I'm going to work with you. If you could line up 12 of those patients, I'd love that, to see them, and maybe I can help." And he flew himself down, and we'll talk more about that story. But the point being, 9 out of 10 of the patients had eye misalignment issues, something I didn't even think of measuring as a cornea doc and working on dry eye patients. All 9 improved dramatically, changed their lives. I still see some of those patients today. And it was just fascinating to see to learn what I don't know. There's so much I didn't know after even been in this field for, at that point, 15 or 16 straight years. And it made a difference. But let's start at the beginning, Jeff. Can you walk us through your personal background? Where'd you grow up? Was it always around Mitchell, South Dakota? I know you had a lot of optometrists in your family. Maybe take us through a little bit of that, and how did that affect your career choice and what you ultimately are doing today?
Well, Paul, I was born in Mitchell, South Dakota. Strange as it is, I'm still living in the same home I grew up in. Obviously, we've changed it. Live on a little lake, grew up swimming and hanging out at the beach, and kind of a blue-collar kid. I was always taking apart a lawnmower or fixing something. I just always had a kind of a curiosity of how things worked and why they worked. Had 3 brothers and 2 sisters, came from a fairly big family. Lived next door to my grandparents. They lived in a house, and my father bought the lot next to them. And so I grew up with a real sense of family and connection with those. And we hung out, spent a lot of time together, just living in Mitchell, South Dakota, and enjoying the lake.
Love it. Now, did your grandfather or your father, did they work in the field of eye care? Were they optometrists, or how did, because I know you were very close, and then it kind of evolved over time, but there was some impetus that got you into this field, I believe.
Yeah, my parents always went to work, and, we'd end up after school down at the office. And the big thing when we got to be in 4th grade, I got to go down and engrave names in the plastic temples. They had an engraver, and they used to put everybody's name on the inside of the temples back in the 70s, and when you got to the 4th grade, I guess that was the day you could go down and work at the office. And that was kind of a big thing. I think I got paid a dime for every name I put in a temple, So I'd always been around optometry, but to be really honest, I'd never had really considered it for a career. I got actually involved in aviation. I learned to fly when I was a senior in high school, and I was just really enthralled with aviation. And I kind of started down that path. But as I started, I got my license when I was in high school, decided that I felt like a taxi driver. I started providing pilot service, and I'd fly some doctors to a place and wait all day. And I thought, there's more than just sitting around. And I didn't want aviation to be my job. But I'd spend a lot of time in the office with my grandparents and my father, and listening to their stories and watching them help people. So I had a real awareness of the profession, but I really didn't have this this hunger when I was young to head into optometry.
That's really neat. I've heard of other stories that kind of did that. So at what point did it hit you? I mean, it's there because I was talking to another colleague who, someone said to their son, "Have you ever thought of optometry?" And he said, "No, I never thought of that." Of course, his father, his mother, his aunt were optometrists, and he just never thought of it as a possibility. It's interesting with the aviation passion, which you still use. I'm amazed at how many ophthalmologists and optometrists have aviation backgrounds and fly themselves around. What made you realize, hey, I could do both, on my own with the aviation and then get into optometry?
I think struggling at that early age in life of what I really wanted to do. I went to school in Michigan to an opticianry school. We used to grind lenses, and my father actually ran the optical lab portion of it more as he got older in life rather than seeing a lot of patients. And so he said, Jeff, you're good with your hands. You like to work with optical things. You've been edging lenses. Maybe you want to take over this portion of the business. So I ventured off to Michigan to Ferris State. And after 1/4 of time, I thought, well, this is, if I'm going to be an optician, I might as well be an eye doctor. So I called back and I said, hey, Dad, I'm gonna turn my attention to optometry school. And he thought, well, great. He never pushed me towards it in any way. But I thought, I like this profession. I think I want to be deeper involved than just be an optician. So I ended up going to school, undergrad at Ferris, and then I ended up graduating from the Illinois College of Optometry, where all of the Kralls previous to that had graduated. My great-grandfather graduated at the turn of the century in 1900s with a degree in ophthalmology and otology and optometry. It was a 6-month course. Paul, back then you could do everything but cut their heads off after 6 months, right? I mean, you had all ability to do just about whatever you wanted to do. And so I followed the family tradition and actually went to school there and came back to South Dakota and joined the family practice.
That's really neat. I want to hear a little bit about also this whole, the company side with Neurolens and how that developed. I'm still fascinated by over a decade ago you visited me and how it impacted my patients. And for years, I would start adding in Prism and solve all these patients who did not have dry eye, but they classically had dry eye symptoms. They also had headaches, neck stiffness, dizziness, eye strain, all these things that we were pointing at other issues, and only to find out that trigeminal dysphoria, the medical term for this condition, is extremely prevalent. And I will tell you, it's not only helped, thousands of my patients. My mother-in-law, who let me kind of use this story, she'd had migraines for many years to where I would visit her. And we were going to visit, my wife and I, early on before we had children, and we couldn't visit one time because it was so bad. She had to stay in a dark room and turn all the lights off and no sound. And we'd go up like the next day. And I never thought anything of it. And then a few years after having now this technology, and I like my mother-in-law, I would have taken care of her immediately if I put it together. And I said, how often do you get headaches? She says, 3 times a week sometimes, and for frequent periods, and it can get severe. And I started checking her alignment, got her in for Neurolens. She told me about a week ago, she's had 2 migraines this whole year. Going from 3 a week to 2 in a year. So I'm excited to talk a little bit about this, but can you tell us a little bit about the whole concept of trigeminal dysphoria before we talk about the solutions?
Yeah, I think the interesting piece of the puzzle may be what happened to me. By natural attrition, when I got out of optometry school, came back to South Dakota and started seeing some of my father's patients, right? He was getting close to the end of his career. I was just starting. And the true story, Paul, an old gruff farmer come in one day, and his pinky was twice the size of my thumb, and he was pretty frustrated. And he come to the front counter and slammed his glasses on the counter. And he said, hey, I've had these adjusted a couple times like he asked me. And he goes, they give me headaches. And he said, I don't want to see that young kid. He goes, I want to see Dr. Charles that knows what he's doing. And my father being the ultimate teacher after this, and if I could have left that day, Paul, I would have probably crawled under my chair and got out of the clinic, And, but my father being the great teacher said, Jeff, you did everything right. But he says the problem was the way their eyes are working together. And, obviously coming through optometry school, I understood that. But Paul, he used this very unique device back then called a Turville infinity balance. And again, I think what led me down this path was my curiosity. And I said, well, Dad, what does it do? What's so different about this? And come to find out what it really did is it isolated how your central vision and your peripheral vision work together. And that was kind of a foreign concept to me in its own way. We went to school and understand pursuits and saccades, quick movements and slow movements, but there's a balance between how those two systems work together. And come to the realization that the coordination of how your eyes line up together is a balance between your central vision and your peripheral vision. I'm looking over here at your name, Dr. Paul Karpecki, and I see if I look at the letter K and don't take my eyes off it, I know there's more letters, but I can't see the letter C in your name unless I move that eye to the C. And as I tell many of my patients, you can see the individual hairs of this eyebrow or this one, but you can't see them both at the same time. The balance between the movement and the alignment of those systems does not send its signal through your optic nerve. It sends that signal through the nerve in your sinuses called your trigeminal nerve. And so the constant imbalance between how these alignment systems of our eyes work together is stimulating that nerve and making people symptomatic. And when the lights went off, and I spent a lot of time trying to understand this, and when the lights finally went off and we realized what the mechanism was and why these people were symptomatic, it became a fun project to try to design a device that was much more efficient, quick, and then a lens that could solve the alignment problems that existed with our patients that we're seeing every day. So that's in essence how this all kind of transpired and took off from the beginning.
I love that. That's really amazing. And I'm grateful you pursued it, because I just think of all the patients it has helped. TBI patients just naturally have this, patients with migraines. I mean, if someone were to come to me and say, there's a way to basically eliminate 50% or more of all the migraines in the United States with aligning their eyes with glasses, I would think it's impossible. And I see it all the time now. These patients coming back and their migraines are gone, their frequent headaches are gone, their neck stiffness. But so many doctors have ideas like you've had, but just stick to their day job. They don't make the leap. What made you realize that I got to get this out there, in terms of helping people or the opportunity? What made you find the way to get to the next level and help so many people?
It was a combination of a help from a lot of people. And one guy I got to give a lot of credit to is an ophthalmologist by the name of Vance Thompson that you know well. And in fact, I think Vance initially got us connected. So he's the ophthalmologist, one of the best in the country doing LASIK. But as we know, some LASIK patients end up with dry eye issues when they're done, that they just can't seem to get over that hump, right? And so I started solving some of these common patients that we had together. And he called me up one day, and I can quote exactly what he said. He goes, Jeff, I'm taking people out of glasses and you're putting them back in, but they tell me that their eyes burn when they don't wear these and they get headaches. He goes, I'd like to meet with you. And he came to Mitchell and asked the same question. He goes, is there a coating on these lenses that's keeping the moisture in? And he's cupped his hands around his eyes. And I said, no, Vance, it's this feedback loop. And our trigeminal nerve obviously gives us a sensitivity of our cornea. It also tells us where our head to go, and it affects our sinuses. So Paul, a lot of these symptoms have a lot of the same type of symptoms. The glare bothers them. They get some headaches here, but they don't stay here. They end in the back of their head because your eyes and your head have to work together. They do all the time. And then the sensitivity of your cornea is innervated by the fifth nerve. And so when I started explaining this to him, he got pretty excited, and we started working in conjunct with each other. At the same time, a neurologist by the name of Dr. Krall Nelson called me up, and she said, how do you make Heather's headaches go away? And Heather was a patient somewhat like your mother, but she had irretractable headaches. That led to a meeting with her, Vance Thompson, and an entrepreneur in his own right, the past president of B&L Surgical, a guy named Andy Corley. And we had a meeting at a country club in Sioux Falls, South Dakota. And Andy convinced Dr. Nelson we should do a clinical study in their headache center. And she said, well, we have some really complicated cases. She's a neurologist that deals in nothing but extreme headaches and irretractable headaches. She's a specialist in that area, a very brilliant lady. But we ended up doing a study in their clinic, and we made more than 50% of these irretractable headache patients made their headaches go away, kind of like what happened with your mother-in-law. And they're fairly fascinated with the results. If you get, a 20 or 30% increase in headache function or decrease with some medication, that's a big deal. But we had more than 50% of these people's headaches go away. And I think the best way to describe it is when you fix the family, friends, and relatives and spouses of all the neurologists, it gets their attention, right? I want to throw just a couple statistics because it's really fascinating to me as a clinician and a guy that's just curious of why this works. But Retrospectively, we saw 200 patients, and 6 months later, we went and had a nurse call these patients up and say, listen, we just want to know how you're doing again. And can you tell us what's changed with your medication use? Right? I mean, what has really changed? If you're not getting headaches, you're probably taking less, we would assume. 30% of the patients got off 90% of their medications. 56% of the patients got off more than 50% of their medications, and all but 30% were taking less than when we started. And that was undirected by their doctor. They just said, I'm not getting headaches. I don't need to take these things anymore. So it really was a stepping stone to help us understand that this really is something that's really aggravating a lot of people with these types of symptoms, and we really can do something about it. And that just kind of turned the heat up to really pursue this and really to gain traction. So it wasn't a concept, it was an idea. It was just a natural organic growth based on finding a solution to a problem that we didn't understand previously.
That's really neat story, and some good people there. Andy Corley's done incredible things over the years. Vance Thompson did the same fellowship with Dan Dury, the Dan Dury fellowship, about 2 years before me. Of course, his was the surgical side, mine was more the medical side. And but really great people. And Carol Nelson, of course, known for her work in headaches and one of the top experts in the country. And so, an amazing group put together, and it's fascinating how they're seeing this. And now we're able to show these differences in our clinic. Has it been difficult to balance being still in practice and this whole exciting company development?
It really is. It was more difficult in the beginning than it was now. The company was formed with two individuals, Andy Corley and Jeff Krall. And from there, I think there's 100 people in the company, and it's growing exponentially currently. And what's really exciting to see is it had nothing to do with any special clinical skill that I have. It's really a testament to the engineers and the technology itself. And the growth is completely organic, and it's not a big sales force out there running ads on every corner. It's one doctor talking to another doctor saying, you cannot believe the results I had. And like you, Paul, everybody's getting the same results as you and I've had using the technology as it's been put together and presented to the doctors. So the organic growth of the company has been amazing, and it's just based on word of mouth and real life result from helping a lot of people with their problems.
That's really fascinating. Can you tell us, speaking of the technology, a little bit about, for those doctors who might be listening, or even industry people who are kind of looking at how does the lens work? Because, years ago, when we first visited me, we'd put a little prism in and it helped, but then the patients would get some prism creep and it'd keep having to clean. Now I don't have that issue anymore. Now I see patients who headaches go away, their dryness, their eyes go away, stiffness goes away. They don't come back in a year later saying, I need more. Tell us a little bit about the technology itself and why it's so different than anything else out there.
Well, that's a great question, and I'll try to articulate it the best I can. Sometimes it's harder to explain than I want it to be. But as we talked earlier, there's a balance between your central and your peripheral vision, and you really can't do that in your exam room. I mean, you can take a phoria, that's a gross alignment, but we all know clinically we've seen many people that have 5 doctors, let's say, of exo distance and at near. You have 2 patients with the same measurement, one's symptomatic and one's not. And we call one symptomatic convergence insufficiency and one asymptomatic convergence insufficiency. And I always said, isn't that convenient? And why is that? Because there's more things going on than just a gross alignment. And that's what we've all tried to do clinically in our practices. But the Neurolens measuring device, what it actually does is it helps us understand how your peripheral vision is coordinated with your central vision. That's really a novel way to do something. And so the device gives us an understanding of that and actually a more accurate measurement of how those two systems work in unison with each other. The other thing the device does, it actually takes 10,000 measurements in every patient, because your eyes aren't really static. They're actually scanning constantly. They say they move 3 times a second, as you scan whatever you're looking at. And so this device can look into those things in totality and give us a better overall look of what's happening with someone's alignment. So once you solve what their alignment is at distance, we have another problem. And as when we look left and right, our lateral and medial rectus kind of scan the world when we're driving down the highway, right? That's our 3rd and our 6th nerve. Those 2 nerves balance left and right movement. But when we look down and in, our 4th nerve starts playing in effect. So in primary gaze, our 4th nerve just basically does cyclotorsion. It rolls our eyes. But when we look down, it starts to influence how our eyes line up together. And we all know as clinicians that there's a different amount of alignment at distance than there's alignment at near. And when we started to understand that we had to resolve the problem in both places in order to make these people asymptomatic, then we started to see the results go through the roof. And so in other words, every movement your eyes make, I look this direction, my brain says, realign my eyes. And at distance is doing that, and we can solve that problem. And the feedback loop, the proprioceptive feedback, the position senses our trigeminal nerve. When you look at near, we have the same thing going on, except the alignment of our eyes now is different at near than it is far away. And so unless you solve the problem in both places, you have an awful hard time making these people free of their symptoms. Now, you can help them with standard prism, but what the Neurolens actually does is that we have a way to change the amount of misalignment at distance compared to the amount of misalignment at near. And so that's what's really revolutionized the change. The really interesting thing that I've noticed, and I think you have too now, is that I have about 20 to 30% of these patients that after they wear these lenses for a year, many irretractable headache patients, they take them off and they said, I just don't have headaches anymore. I don't need to wear these. And I don't know if it's a change in prism from distance to near or solving the problem in both places where the brain kind of says, Control Alt Delete, I'm just going to reset myself. But what I do know is that we're not seeing a lot of prism creep from these patients. No. There's a lot of doctors using these for vision therapy that has really improved the results. And at the end of the day, we just have found, no negative impact of solving these people's problems.
That is so fascinating.
Yeah.
So, I still think even the company is just scratching the surface of the potential. If you think about all the people with eye strain, especially now with digital devices and Zoom calls and even this video podcast, people are looking at it. These are adding much more stress to the system, and we're finding much more of this in patients' trigeminal dysphoria. And I know we're solving a lot, but there's still a lot. But I also think it even goes further. Like I'm starting to find out that some of the patients who couldn't adjust to progressive lenses because of presbyopia can adjust when you correct for their misalignment. And all of a sudden they have much better than like a bifocal, and they're functioning better. And that population may be even bigger or as large as the original population, so of asthenopia patients. So it's quite monstrous opportunity as you think of it. How's the company doing in terms of that awareness today? Because I think it's a very young company.
Yeah, it's a very, very young company. And, it's been hard to articulate and explain all the wonderful things that are happening. But the bottom line is that many TBI, I've seen thousands and thousands that have had these brain injuries that have responded unbelievably quickly. You could probably tell the story of the infectious disease patient that we saw in your office that had been everywhere and was told, you just have anxiety. He's one of the brightest people I've ever met. And we solved his problems overnight by putting him in a pair of Neurolenses, right? And, there's been case after case after that. But Paul, I'm real reluctant to say this, but I think it's important because I think I'm really starting to get a feel for this. That's exciting. The other thing I would just want to bring up that we're starting to get a feel for is that when we look at near, our eyes, our brain says converge and line things up. You can't stop it, right? Your brain sees the sharpness of the edges of my eyes and the edge of the screen in your computer, and your brain says, I'm going to line them up. I don't care what you do to me. And since we all have some exophoria near, and our brain says converge more to try to fix this than they want to do, when we look up close, we use accommodative convergence to solve this problem. Okay, not just straight convergence. We use our accommodative convergence mechanism. And I have many, many, many cases in which I believe this might be another one of the major triggers for increase in myopia. So I'm not here to say that this is a myopia control lens of the future, but I do believe, and what I've seen for many patients, I've seen many patients get less nearsighted over time, which has been fascinating to me. And so I do believe there's a real sound basis for understanding why this does contribute to that problem. And it's interesting, the contact lens manufacturers that have helped with this problem have basically blurred our peripheral vision, right? That's what they've tried to do. And what I'm saying is there's an alignment of our peripheral vision, and what they're doing is they're blurring that and maybe changing that mechanism, but we maybe have a just as good a way to try to resolve that. And so there's a lot of work that needs to be done and a lot of studies, but there's some exciting new things in the horizon for our profession and those people that suffer from myopia problems, that maybe we can help them too.
Yeah, it's really fascinating. It's really exciting to know it's there. But things have gone well. It's been exciting. Any challenges along the way that might help other, visionaries in the field to kind of look out for?
Yeah, there's a lot of roadblocks, and the roadblocks are not your ideas. They're basically people want to see the proof and the results, and then there's just a lot of skeptics when you start changing a concept or bringing something up. We've born and raised to believe every double-blind study. That's the way medicine has basically been able to advance itself over the years. And when you don't have millions and millions of dollars of double-blind studies behind you, you had a hard time getting people to look forward to say, is this really a solution? But at the end of the day, the results and the double-blind studies that have been done now that we can point to show we have incredible results. The Illinois College of Optometry did one of the original ones. But those are roadblocks. It's just getting people to understand your concept and what you're doing, and getting them to move forward. It's a big world out there, and there's a lot of ideas floating around.
That's really cool.
Yeah.
Jeff, thanks. This was really a phenomenal interview. A lot of incredible insights, clinical as well as business practices, as well as alignment, all things kind of coming together. I credit you with all of that and what you're doing for so many millions of patients in their lives. Someone listening, today and hearing your story, what's the best way they might be able to contact you?
Probably the best way, Paul, is my email. It's Jeff, my first name, at Krall, Krall, iclinic.com, just the way it sounds. Jeff at Krall, And the wonderful thing about our profession, Paul, is we've been able to help a lot of people. And I'm going to make a fairly bold statement, but I really believe that our profession is going to be the major contributor to headache control. And we've just seen that. And as we gain traction, what's exciting is I think there's a lot of patients that haven't been helped that we're going to make a tremendous difference in their lives. And very quickly, we're gaining steam to solve those problems for these patients that walk in our office every day.
I think you're right. And these patients are, spend thousands of dollars per year. Many are recalcitrant. No matter what they try, it's not working for them to get there. No one's thought of the component related to the eyes of misalignment. And I can walk into a patient in there and notice that testing's fine, even though they have dry eye sensation in their eyes. Ask them if they have headaches, and they can describe it exactly in the front, moving backwards. They can tell me their neck is stiff. They have dizziness, glare. It's fascinating how often, I say how many headaches you get. They're frequent headaches. They've had everything you can think of. And then we get a pair of glasses and it corrects for them. And then LASIK's another huge group, because these patients used to have some myopic correction, which created a little basin prism, and they were getting by with that. And then you take that away when you do a refractive surgery, and all these symptoms come in, and we're solving, thousands of those patients now too. It's pretty amazing what this is doing.
Yeah, I think the best way to describe it to a patient, many of these people have come to believe that their headaches are not come from their eyes, right? Because who would think pain in the back of their head has anything to do with their eyes? And the answer is no one. But I can assure you that, and what I tell these patients is, if someone's having a heart attack, they have a pain down their left arm, right? Again, the feedback of the control of your eyes is not your optic nerve. You don't feel the pain on your eye. It's in the sinuses around your eye. So it's kind of a distribution of learned pain. They can't quite connect the dots. That's why I think our profession has had a hard time not looking past some of these symptoms and maybe connecting directly what's related or what's really causing the problem.
Makes a lot of sense.
Yeah.
Jeff, thank you for all your great insights. Great interview. A lot of really amazing revelations in terms of the technology, in terms of understanding this clinically, even in terms of entrepreneurship. We really appreciate you taking time out of your busy schedule to join the OIS podcast, and I look forward to the next time we can connect again.
Hey, my friend, it's been wonderful, Paul. You take care and say hi to your family for me, and thanks again for including me.
Thank you. Likewise, cheers, Jeff. Thank you, my friend. Bye-bye.
Okay, bye now.
Thank you for listening, everyone. We hope you've enjoyed this episode of the OIS podcast. Be sure to subscribe to our iTunes channel so you get the latest ophthalmology insights. Got a story of your own to tell? Apply to be a guest at OIS.net.